Hello, good morning. This is the first lecture for the our graduate course 2021 spring semester. Today, let's talk about the newspaper, some title about the coronavirus tracking system. Okay, I think the reporter, her name is Kelsey Warner and Serena Arlovais. Anyway, this is article I found 2020 April 28. The coronavirus. Doctors urge public to help track COVID-19 cases with the tracking application. So normal users download the smartphone applications to track the nearby COVID-19 patient. Even though the smartphone, the tracking application track the COVID-19 positive patient, the smartphone does not alert the smartphone owners, but the information, the information is directly reported to the government tracking center. And then the government gather information who are contacted to the coronavirus positive patient. And they can produce statistics and if necessary, they can send the message to the contacted person to test whether they have coronavirus or not. Yeah, this let's see this focused on the applications, how the application works. Okay. 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 Doctors tracking countries' COVID-19 outbreak urged the public to download an application. Yeah. The application could help them track undetected carriers. Okay. The application use Bluetooth signal. Okay. The smartphone, each smartphone has a Bluetooth function. So the application use Bluetooth signal to track interaction between people who have the program on their smartphones. Okay. So normal users, they have a smartphone. They have program on their smartphones. Also, COVID-19 positive patient also have smartphones. The smartphone also programs on their phones. So senior health officers, the government, urge residents to install the application on their phones to help tackle. Okay, reduce the number of cases, positive patients. Okay. So the authorities this is conventionally authorities sought to manually trace every person that could have been in contact with a positive patient before they were diagnosed. But this method depends on individuals' memory and their honesty. They can tell a lie. Okay. So this is the disadvantage weak points of manual tracking system. Okay, Dr. A.I. Holson, a spokesman of country's health sector, said the smartphone application system could only work with widespread public support. Yeah. So he say it is very difficult to trace back who one was in contact with, especially in public place. She, not he, she. I think he that is a lady. Okay. This will enable individuals to learn more about their health status and their exposure to positive cases. Okay. The COVID tracking applications are being rolled out across the globe to simplify the process. AI Hosen is adaptation of two existing applications called Stay Home and Trace COVID-19. Okay. In Australia, by that time, more than 2.5 million people downloaded similar applications called COVID Safe. AI Hudson application is available Google Play, Apple Store. Okay, next sentence is important. The application does not alert you or anyone else to a person who may have the virus, but allow the government to track you down. If necessary, let you test and prevent you from passing it on. Okay? Dr. A.I. Hosani say all of the data gathered would remain anonymous because this data belong to personal privacy data. Okay. So technology, the tracking and Bluetooth and the tracking software enable us to do contact tracing in much better, more sophisticated way. Okay. We are still calling individuals to get additional information. But this robust system will enable us and different health authorities to conduct their role and provide live data on disease. In early February, Minister of Health of the Rahman AI Oasis say about 150 people were tested for each of the 7 confirmed patients, which took about 500 people working in communication and logistics. Okay. So the tracking application, smartphone, can track 500 people for one patient. So this application is likely to become a key tool, in UAE's legs across the country. But it is by no means a replacement for a vaccine. Nor should it be confused with the immunity passport. Immunity passport. World Health Organization, this is WHO, who said while most people may have some immunity following recovery from COVID-19, it is unknown how long such immunity lasts. Antibody tests are still unreliable. As a result, people granted immunity passports could return to normal life with a false sense of security, only to fall victim again. Okay. Also, according to WHO, at this point in the pandemic, there is not enough evidence about the effectiveness of antibody-mediated immunity to guarantee the accuracy of immunity passport or risk-free certificate. But that does not discount how powerful data can be in the fight against COVID-19. Okay, AI Hudson. This application uses QR codes as proof of individual's health status. It is color-coded. Those who test positive will be red, colored red. For the negative, is green. Gray is for those who have not been tested yet. Users need their the country resident ID number, phone number to authenticate the application, which also allows individuals to receive a medical test result directly to their device. Okay. Okay, the application still have a question here. That will help authorities better understand the symptoms of COVID-19 in different regions. It was launched in quick time, but there will be many enhancements. We are looking for feedback from the community on how best we can serve them. Besides UAE, several countries are taking similar tech-based paths. Hong Kong. Hong Kong reopened the public space on Tuesday, asked those who arrive in the city to wear tracking wristbands to ensure compliance with the quarantine orders. South Korea. South Korea use more advanced techniques. South Korea has a smartphone application to map movement of recovered virus carriers. location tracking. Okay. In the US, Google, Apple, Facebook are all looking into how to use location data to provide public health input to the government. Because the Facebook they maintain a huge amount of information, personal information, movement data of the people who use smartphones. You can imagine now the number of persons who use Facebook is greater than the number of Christian in the world. Facebook, they know where you are. Okay? Which way you move. Okay? Yeah. So Google and Apple, Facebook are looking into how to use location data to provide public health input to government. Apple and Google are also collaborating with researchers at Massachusetts Institute of Technology on short-range Bluetooth signals in an effort very similar to UAE application. Okay. So this UAE application, okay, is a conclusion. This UAE application use smartphone program application and Bluetooth signal. So the users install the application, download the application and install the application, and then the contact data is sent to the government. Okay. So some weeks later, we moved to our paper. Our paper use same concept as this UAE applications. Use smartphone applications, but different. Our paper use the idea of virtual Internet of Things, okay, in the smartphone. Okay. Okay, this is the lecture for first week. Okay. So assignment is you summarize this article and submit to the eCyber. I'll put the direction how to submit the assignment. Okay. 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 Good to be with you. Okay. Let's see next week. Bye bye. Okay, sorry, one page left. Okay. The state of Massachusetts in the United States, San Francisco also, contract tracking, contract tracking, so local mobile applications are under development. But the earliest effort have come from China, where the outbreak originated. Okay. They use WeChat program applications to evaluate the public health risk posed by a user based on their state-issued ID number, address, travel history, and the self-reported health status. They are given health code or colored code from green to green. No. For green, no. Green color, it means you can go anywhere. Go to anywhere. Allowed to go. Good to go. But for red color, you must remain inside your home, quarantine. Okay. The adoption is the biggest challenge for the success of any of these initiatives. Under normal times, the launching this application is really about attracting people to volunteer their information. If you were asked me to submit my personal data information to mobile applications, I probably will be unwilling to do so in normal times. But during this crisis period, cost of collection become virtually zero, because without having this data QR code, then it means immobility. So health minister say, we can remove this virus. We can conquer this virus only if we all act together. Each one giving the others protection, and they will giving the others the peace of mind.